So there's been a lot talked about today in reference to pain relating to physician-assisted suicide. And there are a few things that my opponents have overlooked. First of all, we did not state that all terminally ill patients are experiencing unmanageable pain. But there's not a person in this room who can deny that there are people out there who are given less than 6 months to live who are experiencing a great amount of pain. Now, to give you an idea of what a great amount of pain actually is, it's hard to explain. It's hard to explain to people who've never experienced true pain. Most of you in this room would probably say that a broken bone is a severe amount of pain. Personally, I've broken 39 bones in my life, 6 of which were severe. Most of you have never experienced a break so severe that even weeks after you've had a steel rod placed through your femur to make sure that the bone sets correctly, that when you wake up at night, because you've shifted slightly, you're already waking up in pain that is so searing and so overwhelming that you can't even think. Now, to give you an idea of how severe terminally ill patients actually experience pain, on McGill's Pain Index chart, which is a chart that ranges from 0 to 50, a broken bone is only rated somewhere near the mid to low 20s on a scale of 1 to 50. Now, cancer patients, even ones that are terminally ill, can experience pain mid to high 20s. And then you have terminally ill patients who experience pain in the mid to low 30s range. This is somewhere around experiencing child labor or childbirth when you're prepared for it. Now, what we're advocating is not that we assist suicide in all terminally ill patients, especially ones that experience pain. We're advocating that they have the option to choose to end their life with dignity, where they're not uncomprehending of the world around them because of the amount of pain that they're experiencing, where they're not sedated and dulled by the amount of pain medications that they have to be administered just so that they don't experience life in that amount of pain. It's not something that's new. It's not something that we're just throwing out there because we thought it'd be a good idea. This has been around for thousands of years. The Japanese would end their life voluntarily through a form of suicide called seppuku. And they would do this because they felt dishonored, or they felt that they had shamed themselves, and they wanted to die with a sense of dignity. That's what we're advocating. We're advocating for the option to choose how you live. Now, we're not saying that palliative care is not a good thing. We are saying that palliative care should be the first option, and if that works, that works. The Death with Dignity National Center says that the greatest human life, or the greatest human freedom, is to live and die according to one's own desires and beliefs. The most common desire amongst those with terminal illness is to die with the same measure of dignity. For advanced directives to physician-assisted dying, Death with Dignity is a movement to provide options for the dying in control of their own end-of-life care. It's not something that we're saying is the right answer. It's not something that we're saying is the wrong answer. It's not even something that we should advocate. But we're saying that this legalization of physician-assisted suicide, not euthanasia, should be an option for anyone who is given a terminal diagnosis. We're not even saying that we should force doctors to say this. Physician-assisted suicide isn't about physicians becoming killers. Peter Rogatz, Vice President of Compassion and Compassion and Choices in New York, wrote that it's about patients whose suffering we can't relieve and about not turning away from them when they ask for help. Will there be physicians who feel like they can't do this? Of course, and they shouldn't be obliged to. But if other physicians consider it merciful to help such patients by merely writing a prescription, it's unreasonable to place them in jeopardy of criminal prosecution, loss of license, or other penalty in doing so. What we're talking about here is not murder. It's not even an unreasonable request of death. What we're talking about here is giving the option to end your life in a way that you see fit. We're talking about giving people the option, because you have control of your own life. You have all the things that you ever wanted, and when those things are taken away from you, when those things are stripped of you, this should be a viable option. Even Dr. Francis Camp, professor of philosophy and public policy at John F. Kennedy School, argued that when pain is so great, it's possible for death to become the lesser of two evils. And yes, death is considered an evil, but sometimes it is the better option.